So, you've decided to come in and find out how you might relieve your spine or back and neck pain. Your first visit with us, if it's scheduled in Boston, will be on our East Campus in the Shapiro Clinical Center. Please remember, you'll need to bring a few things with you.
Most patients prior to seeing the surgeon will have an MRI that was done within the last 6 months. So we just ask that if it wasn't done at Beth Israel to bring that CD with them to the visit so that it can be reviewed.
After a few routine tests, you'll meet with a member of the Spine Center team.
So first you will tell me exactly where your pain is, what bothers you, and the question I really like to ask, if there's one thing you want me to fix, what would it be? Over years I found that very helpful to really focus on the main problem. And then most of my next questions, my physical exam, my review of imaging gonna be focused on that one big thing.
So basically, moving your shoulder is causing pain.
Right.
If I feel that my role satisfies your condition, then I prescribe the appropriate treatment, which may be a referral to another specialist. It doesn't mean necessarily it's going to be surgery, but I will be the only one making the decision. However, if the case is more challenging, if we feel like something else may be missed, or I feel like my expertise is not enough to cover this type of disease that I believe you have, then it's going to be a multidisciplinary conference. Your case is going to be discussed.
The concept of having a spine center with a very durable and robust set of practitioners is to be able to provide care for whatever problem comes into the spine center, and most of those problems are actually non-surgical.
So we have physiatrists, we have anesthesia pain physicians. Both of those providers specialize in what we call non-operative spine care. They're still spine specialists. In fact, they're the most important spine specialists because they're taking care of the majority of patients, as the majority of patients don't require, don't want, don't need surgical intervention.
Often I find myself giving a lot of advice on how to improve their spine pain or function, referring them to appropriate caregivers to carry on the non-operative care of the spine.
First of all, the surgeon has to decide whether this disease the patient has is something that surgery is going to help. Second, have we exhausted all conservative measurements before we resort to surgery? Number three, how important is to have the surgery now versus 3 months from now or in 6 months from now? You need to discuss physical therapy, you need to discuss medical management and potential injections, steroid shots, and also set the expectations. It's important to set a plan with the patient.
Now this might sound like a lot on a first visit, and that's because it is. We're going to perform a comprehensive evaluation. Make sure you take good notes, or better yet, bring someone along with you if you can.
It's difficult to digest it all, and so I think a patient advocate, if you will, is helpful. So they're very important. In some of the riskier types of surgeries that are done, it's very important to have the family involved. Healthcare proxy or significant other that can then help make decisions as well.